Okay, what's up, Katie? So here we go. This is for the lower back and hip to really zero in on the space between the ribs and the top of the hip bone, the ilium, and also that whole lateral line of the glute, into the quad and hamstring, all the way down to the ankle. Okay, and then also up through the triceps, the back of the shoulder, serratus, this whole lateral line. Okay, so we're trying to gently open it up. So what you can do is grab the strap, and what I want is, because we're going to be working both sides, okay, so you can allow yourself to dangle, and you don't have to do any work within that hip. You know, you're just kind of holding on with your arms, but you're letting your hips drop, okay, and notice where that tension is, okay, in the lower back. So what I want you to do is go into where it hurts and then back off a little bit so it's not too intense, and then do small little micro movements, start with your upper torso, left and right, twisting your upper shoulders and just feeling the connection through your ribs, through your obliques, down to maybe the QL or whatever's going on deep in that lumbar. So small little micro movements to isolate what's most relevant and tender within that lower back. Okay, so hopefully that doesn't hurt any, because we don't want to go into pain. This should be relaxing. What you can do is shift to the other side, and I actually want you to contract then the opposite side. So I was just stretching my right side, so now I'm going to contract my right side as I relax into a lateral bend. Okay, so I'm accentuating the contraction here, and I'm holding on just so I don't have to do any work for holding my body up. I can let it relax and hold that contraction for 10 seconds. Okay, and then relax. And so the idea is you're contracting your QL and oblique on the side that's maybe tight, and that's helping to relax the opposite side, but you're also activating those muscles deep that are tight within the area that has tension, and you can, really focus on intensifying the feeling of the pain a little bit, unless it starts shooting. I don't want any shooting pain if it's nerve, but just contract, hold, and then focus on the opposite side opening up. So that's allowing this space between the ribs and the hip on the opposite side get a little bigger. Okay, and then you can do it the other side as well, where I contract, feel a good stretch, contract my left side, and feel my right side open up between the hips and the ribs, and let my hands dangle. So my hips are dropping, my shoulders are opening, and I'm breathing and just letting go all the way up that line through my tricep and deltoid, all the way up, to my wrist. And just feeling that connection through all those structures, and then the integration is to then bring movement to all those points of reference: your wrist, back of your shoulder, your ribs, your hip, your lower back, your glutes, all the way down to your heel. And then think of it like a bent, like fuzzy pipe cleaner, and then you're moving that bend around like a wave to just really continue to open up that whole lateral line. Okay, so start there. That's the assessment phase. Once we have felt some tension, we're going to move to the direct pressure phase, which is basically then targeting any area. And what I would suggest, Katie, because I think you have the linear, is to get the that lateral edge right above the hip bone, okay, on your side. And then so important is to approach really gently and slowly and allow the tissue to absorb the pressure that you're applying. And if the pain starts going up, find a different spot, but find one area. And the idea is we're gonna melt the tissue around that direct pressure. You're gonna visualize the muscle letting go. You're gonna visualize the tight bundled cords turning into water hose full of water, open, soft, supple, and just relax and breathe and visualize that opening up and letting go. And you're gonna explore the area between your hip and your ribs, sinking as deep as possible, targeting that QL muscle is what I know we can focus on. And then the other area, which might be too tender now, is around the femur head, right? So right on that femur head, but that area, as a horseshoe, I think I talked about this before, the muscles of the quad attach, the hip flexors, TFL, the glutes attach, everything around that femur head. So find any area that feels appropriate. A lot of times this area right below the glute is loaded with tension, and that can directly be affecting the hip. Okay, so I can just put some pressure, and that area can really handle a lot, but the focus is on the breathing and the letting go of the tension. Okay, just what's appropriate, what's the minimal effective dose of pressure, and then as you let it go, you just continue to intensify, sinking deeper and deeper into each layer of that muscle, and allow it to continue to soften, and then continue to apply a little more pressure as the body says, okay, but don't force it. You can't force it. You have to be slow, and just enough to stay relaxed. Okay, so that's the practice, and then just follow that, around the hip, explore the anatomy, and then give me feedback on what's going on, where you found, and then we can go to work on that area specific. Okay, talk soon.